Hi and welcome to UroChannel. In this video series, I'm explaining basic trauma care for everybody, with the victims of war in the Ukraine in mind. With reports about civilians getting wounded 24 hours a day, cities being wiped out, and massive damage to the infrastructure, I hope to be able to help with these videos. They contain information that might be life-saving in certain circumstances when no hospital or doctor is within reach. Therefore, please share this video with your friends and help to distribute it to the people in the Ukraine. It is an easy step for you to help me help them and cost you nothing. I will also donate the revenue from this video to the Ukraine Humanitarian Fund of the UN. So with this being said, it is time for the last two letters in the ATLS trauma care succession. I advise you to watch the previous videos so that you get the order right and start with A for airway support until you arrive at the letter D, which is disability with paralysis and nerve damage, and E, exposure, environmental control, especially keeping the patient warm and preventing hypothermia. Disability means that you should perform a rapid neurological evaluation after you have established free airways, made sure your patient is breathing, and took care of blood loss. Neurologic evaluation starts with a level of consciousness. We did that already briefly in the circulation part, remember? Reduced consciousness might be a sign of major blood loss. There are different levels of consciousness. Either there is no restriction, the patient is awake and able to talk. Then he might be able to show that he hears you, but is unable to respond. If you don't succeed to get some response with talking, try to shake him lightly and progress to painful stimuli. The sternum is extremely sensitive to pain. If you knead your knuckles on the patient's sternum, it is a strong stimulus, and if he doesn't respond to that, he is in a coma. Besides bleeding, lack of oxygen might be the reason, so start from scratch. Re-evaluate the airways and breathing of the patient and fix that if you find any problems here. Another reason for lack of consciousness might be direct trauma to the skull and brain. Therefore, have a look at the pupils. Do they react to light? Use your smartphone light to test that. Compare the diameter. Is it equal, or is one small and the other wide? Anything unusual here is a sign that something might be going on inside the skull. If the patient is able to speak, try to establish other signs of neurological damage as sensitivity and motor control. Is there any numbness anywhere? Is he able to move his body, legs and arms? Inability to do so are signs of nerve damage, so think of the spinal cord and be very careful not to worsen the condition by moving around the wounded without making sure the spine has been stabilized before. This is especially true for the neck. You probably don't have access to a stiff neck, so wrap something firm around the neck to stabilize it as much as possible. A piece of fluffy foam material would work that you can reinforce from the outside. If you suspect damage of the spine further down, use a plank to stabilize the spine. You will need two people to assist you. Two gently roll the body to a 30 to 45 degree angle while keeping the spine and neck straight and stabilized. The third person shoves the plank underneath. Then use whatever material you can get hold on, like gaffer tape, whatever, to fix the wounded on that plank or board. The last very important part is environmental control. Loss of body temperature, which is called hypothermia, is an important contributor to death. In order to keep up the body temperature, you will have to have control over two things. One is bleeding. Massive blood loss will cause the body to become cold. So go back to letter C and think about areas that are linked to massive blood loss, in particular pelvic fractures and long bone fractures. The second thing is environmental temperature. Try to move the patient to a warm environment and cover him with warm blankets to prevent him from cooling down. When you are done with E and professional medical help is still not on the way, there is one important thing to do. reassess. Start from letter A and check again for airways, breathing, circulation, disability. Take care of any issues you will find in your checkup. Thanks for watching. Bye-bye.